Yesterday saw a record 931 patients without a bed in our hospitals. And Health Minister Stephen Donnelly is warning it could get worse before it gets better. I find it extraordinary. We have almost 1,000 patients lying on trolleys, lying on floors, in fact, in some cases, in our emergency departments. And we have the head Mandarin, we have Robert Watts, we have the head Minister for Health, we have Stephen Donnelly, both kind of going, oh, it'll get worse before it gets better. It's almost like they're bystanders looking at our health service, the way we all are scratching their chins going, goodness me, it's a mess, isn't it? And it is a mess. And it isn't right. And we have thrown money. We have thrown so much money at the health service. 350 million has been spent on the winter plan. That's huge money to start off with. But aside from all of that, we have added billions and billions over the last 2 years to its annual budget. Not just, a COVID related payment. The annual spend now in health has gone up by a magnitude of billions, and we are not seeing the kind of return for our money that we would hope. We are not seeing a dent in what people really want, which is access to hospital, access to appointments, access to our emergency services, and a bed when they need one. And something has to give. And I do believe that it is fixable, by the way. I don't believe that it is just like looking into a ditch where, nothing can be done. The health service is unfixable. Of course it's fixable. It works in other countries. And the amount of money that we're spending on it, we could have nearly ripped it up and written, with a blank page and restarted it. But for some reason, we're not doing this. I'd love to hear from people this morning if you are affected, if you are in an emergency department or have been in one, if your loved ones, probably worse to see your loved ones do it, if they have been in an emergency department and you are among those people who have been 5 days on a trolley or 4 days on a floor or those types of things. I would love to hear from you, because it is unacceptable and something needs to change. And there should be more accountability when people are being paid hundreds of thousands of euros every year to run the health service, and it still isn't fit for purpose and still isn't functioning for the benefit of the people that need it. I mean, we're being asked all the time to protect the health service. My understanding was the health service was there to protect us,